Hi everyone, welcome to the Gold Medal Caregiver channel. Here we share tips and tricks on how to easily care for elderly family members or patients at home. If you have someone at home who needs care, don't worry. We'll not only help you manage their daily life, but also teach you some practical methods to help them gradually improve their health. That's our mission at Gold Medal Caregiver. All right, next up. Today we're talking about caregiving techniques for delirium in the elderly. What is delirium? Simply put, it's when an elderly person suddenly becomes confused, speaks incoherently, or even doesn't recognize people. This is a short-term condition that can occur before the onset of dementia and is usually related to illness, medication, or changes in environment. It is important to make the best use of the remaining time to correctly assist the patient in adjusting and avoiding subsequent dementia. Caring for someone with delirium can be challenging, but with a few techniques you can make the elderly person more comfortable and reduce your own stress. Let's take a look at some of these methods. Tip number 1, figure out the cause. Delirium doesn't just come out of nowhere. You need to find out why it's happening. It could be due to an infection, like pneumonia or a urinary tract infection, dehydration, low blood sugar, medication side effects, like sleeping pills, or even being in an unfamiliar hospital environment. Another major possible cause, and the most common one, is long-term lack of sleep and mental exhaustion in the elderly. The first step for a professional caregiver is to work with the doctor, checking blood pressure, blood oxygen levels, urine, and other things to find the root cause and treat it accordingly. You can observe when the elderly person started acting differently, such as after surgery, after a change in medication, or if they've been sleeping well. Write it down and tell the doctor to help them find the cause quickly. How? Take their temperature daily, check for fever or signs of infection like cloudy urine. Keep track of the medications they're taking, especially any new ones, to see if there are any side effects. Make sure they're drinking enough water, as dehydration is very common. Tip number 2, stabilize the environment. Elderly people with delirium are very sensitive to their surroundings. Unfamiliar places or chaotic noises can make them even more confused. Professionally, we try to keep the environment simple and familiar. Keep the room quiet, turn off the TV or loud music, and maintain a peaceful atmosphere. Lighting should be moderate. Open the windows during the day to let natural light in, and use a night light at night. Too dim or too bright is not good. Place some familiar items like family photos or pillows to give them a sense of security. This can reduce their confusion and stabilize their mood. Tip number 3, gentle communication. During delirium, the elderly person may talk nonsense, mistake people, or even get angry. Communication requires skill at this time. Slow down your speech, use simple words like, "Dad, I'm here, it's okay," and repeat it a few times if needed. Don't argue with them. If they say, "I see something strange," don't say, "There's nothing there." Instead say, "I'll help you look, don't worry." Use more eye contact, gentle pats on the shoulder, and other actions to make them feel cared for. Patience is key. Being confrontational will only make them more confused. Tip number 4, maintain a regular routine. When an elderly person has delirium, a disrupted routine can make it worse. Frequent nighttime urination is a common accompanying issue, leading to chronic sleep deprivation in the elderly. If this occurs, it's recommended that the elderly person wear diapers at night to improve their sleep. Professional caregivers will help establish a simple daily routine. Wake them up at a fixed time in the morning, open the curtains to let them know it's daytime. Plan some light activities during the day, like sitting and listening to music or flipping through a book. Just make sure they don't get too tired. Have them go to bed at a fixed time at night and reduce water intake before bed to avoid getting up and wandering around at night. A regular routine can help their brain gradually regain its rhythm, reducing the periods of confusion. Tip number 5, pay attention to diet and hydration. Elderly people with delirium often forget to eat and drink, but nutrition and water are crucial for recovery. Prepare soft, easily digestible foods, like porridge or steamed eggs with low oil and salt. Make sure they drink enough water throughout the day, 500 to 1,000 milliliters depending on the situation, in small sips, and don't force them to drink too much at once. If they don't like plain water, add a little juice or lemon slices to encourage them to drink. Once dehydration or low blood sugar improves, the delirium may lessen considerably. Tip number 6. Traditional Chinese medicine to regulate the mind and spirit. Traditional Chinese medicine views delirium as a disturbance of the heart and spirit, or a deficiency in qi and blood, especially when coupled with lack of sleep. The elderly are already frail, and illness makes them even more susceptible to confusion. Traditional Chinese medicine offers a few approaches. Dietary therapy for calming the mind. Prepare some lotus seed porridge or lily bulb soup to nourish qi and calm the mind, which can help with mental restlessness. Avoid overly tonic foods like ginseng, as they might be too much for the elderly. Acupressure. Gently massage the shenmen point on the wrist at the base of the pinky finger, on the ulnar side of the flexor carpi ulnaris tendon, and the neiguan point located on the inner forearm 2 finger widths above the wrist crease between the 2 tendons. Do this for 5 to 10 minutes daily to stabilize the mind and alleviate anxiety. These gentle methods can help the elderly person calm down, and they work even better when combined with Western medical treatments. However, consult with a traditional Chinese medicine practitioner first to ensure it's appropriate. Tip number 7. Be mindful of safety. Elderly people with delirium may wander around at night, fall, or even pull out medical tubes, so safety must be ensured. Install bed rails. Clear the floor of clutter to prevent tripping. If they're in the hospital, inform the nurses about their delirium and ask them to keep a close watch. Don't restrain them, as this will only agitate them further. Speaking to them gently and reassuringly is more effective. Safety first, don't let them get hurt. Tip number 8. Caregivers, don't push yourselves too hard. Caring for an elderly person with delirium is exhausting, and you need to take care of yourself. Otherwise, both of you will collapse. Take turns caring for them. Ask family members or friends for help. Share the responsibility. When you're tired, take a break, have a cup of tea, go for a walk. Don't bottle up the stress. If you can't handle it, ask your doctor or the community if there are any support groups available. Don't try to bear it all alone. When you're in good shape, you can provide better care for the elderly person. In summary, when caring for an elderly person with delirium, pay close attention to the frequency of nighttime urination. These 2 factors contribute to dementia and must be avoided. Identify the cause, stabilize the environment, communicate gently, and maintain a regular routine. Ensure good sleep, proper diet, and safety. Traditional Chinese medicine can also be helpful, but the key is patience and attentiveness. Delirium is usually temporary, and with proper care, the elderly person can gradually regain clarity. One final reminder. If the elderly person suddenly becomes more confused, develops a fever, or experiences unusual breathing, seek medical attention immediately. Don't delay. This is not a small matter and needs prompt attention. All right, that's all for today's sharing. I hope this was helpful. Remember to subscribe to our channel and see you next time.